Hi, my name is Alyssa, and I'm the project manager for the CoRDS registry here at Sanford Health. I'm going to share a little bit more today with you all what CoRDS registry is and where Sanford Health is and what we do here. I apologize, I'm not able to join you in person today, but my colleague Polly Gale, she is there and she will be able to answer any questions for you. So the mission and vision of CoRDS is bringing together patients and researchers to accelerate rare disease research. So as I mentioned, Sanford Health is a large hospital and they sponsor this registry. So we are able to provide this service for free to advocacy groups, patients, and researchers anywhere in the world. This is our Sanford Health footprint. So we are located in Sioux Falls, South Dakota. We do have hospitals and clinics in other parts here in the Midwest, as you'll see in this slide. And here is a photo of Sanford Research. So if you were to ever call in to speak to the CoRDS team or mail in your questionnaire, this is our building. This is where we are located. Sanford Research is a branch of Sanford Health. So with CoRDS, we understand that in rare diseases, oftentimes patients and families, they are the experts in their rare condition. So in order to properly look into the diseases, researchers need to have a full understanding of what's going on with these conditions or diseases. And so this is where Sanford came up with the idea to have the CoRDS registry. So some of you might be wondering, what the heck is a registry? So a patient registry is a collection of data captured regarding a group of patients. This could be contact information, demographic information, health information, or quality of life. This can either be entered by a patient or a clinician. So a registry can also serve to contact people later on, or it can serve to build up the progression of that natural history and the data collection process. So CoRDS is a patient registry for all rare diseases and conditions, carriers of the conditions, and undiagnosed. We bring together patients and advocacy groups such as the PBCers and researchers. So unlike other registries, Sanford Health sponsors CoRDS, and it's made available at no cost. So we are a free service. We're free to researchers, free to advocacy groups, free to patients, free to pharmaceutical companies, and we will always be free. So how does CoRDS work? So patients and their families can complete a questionnaire, and then groups such as the PBCers can create a more condition-specific questionnaire. So once you would go fill out your questionnaire either online, by email, or through the mail, you would see that you would have something called the CoRDS standard questionnaire. Then you would also get a questionnaire very specific to PBC. So how can CoRDS help? So oftentimes people will wonder, what's the point in contributing my information about my condition, or why should I answer this questionnaire? So the majority of rare conditions do not have a registry, and many rare disease cohorts have not found their community. It also can help connect patients' natural history data with researchers and clinicians. So who owns the data that you contribute to CoRDS? So participants are the primary owners of the data, because you guys get to control the data that is used. So you get to govern who you want to share your data with and who you don't. You can also remove your information at any point in time. So we manage, and CoRDS manages and stores the information that is required by Sanford's Research Institutional Review Board. So CoRDS will never sell, rent, or lease personal information. Information in CoRDS remains there unless consent to share is provided by the participant. So how is CoRDS data used? So researchers, they're able to petition to receive the de-identifiable data they can receive the de-identifiable data that is provided from the questionnaires that participants fill out. So if a researcher or a pharma company makes a request to review that data, it would only be the de-identifiable data, meaning there's no PHI on there, your name or anything like that. Address would not be shared with them. And it does have to get approved by the Sanford Scientific Review Board. So advocacy groups such as PBCers can also have access to that data, but again, the participants have to share, or the participant has to give information to share that data. So new discoveries are made based on the information contained in the natural history of a rare disease or condition. So patients own their stories, and by sharing each story, scientists and doctors can learn more about how to approach research into these conditions and also for hopefully some treatments. So here is an update of our metrics. You'll see that I forgot to mention CoRDS is disease or condition agnostic, meaning we represent all rare conditions. In our database, we have over 2,000 different rare conditions. We have partnered with about 100 different groups, just like the PBCers that represent various rare conditions, and we create questionnaires for all of those groups. We have, I think now I last checked, and we have over 16,000 participants. And you'll see too that we are in all 50 states and in 90 some different countries. So we have a pretty large network that we cover. So here are some analytics very specific to the PBC's registry. You'll see there are 483 people enrolled, which is a great number to have. However, when looking through the data, it seems like only half of those individuals have actually filled out the questionnaire, which can be a little problematic because think of all of that, all those people that we're missing information on. So please make sure when you do have a questionnaire to go through all of that information that the PBCers have created. And so a common question, I guess, that people often want to know about is fatigue. Fatigue seems to be a symptom that people with PBC may experience. And it looks like of the people who did complete the questionnaire, 179 people said they have fatigue and 23 people said they did not. And so what is the impact of fatigue on the participants' activities of daily living? This is another question that comes from the questionnaire, and it looks like about the majority of people said there's a moderate impact. You'll see here, it looks like 76 people said that. And so another question from the questionnaire is, has the participant been diagnosed with any other autoimmune disorders? And it looks like 126 people have been diagnosed with other autoimmune disorders and 82 people have not. And here's a list, I'll kind of go through this slow, but here's a list of some of those conditions that people have said that they also have alongside PBC. You can also find all of these analytics at the CoRDS booth that Polly has. She will have a stack of this information that she can give to you if you are interested in having it. You'll see this question on the questionnaire is asking if any of these autoimmune conditions were present before or after the diagnosis of PBC. And again, Polly will have a copy of this that she can provide for you as well if you're interested in taking a closer look at it. So by now you might be wondering, how can you enroll in the registry and how can your information also be presented in graphs like that to help spread awareness to not only the community, but also to researchers and doctors, So there's a link on our website that you can go to. You can click that link, and this is the form that you would see. It is our activation form. This is just the start to create your account. So once you hit submit on this page, you aren't done with the online process. You would then be presented this screen here. Your diagnosis would show up right there. You'll see over here, you would want to click the Save and Next button. This will help you walk through the questions on the questionnaire. You'll know you have answered all of the questions when you get to this thank you screen. This is what the portal would look like if you created an online account. You'll see that you are able to update your questionnaire here at any time. We do ask that you go in at least once a year to update the information. This can help to see what's changed, or maybe nothing has changed, or maybe something new, a new diagnosis happened. So that's really helpful if you can go back in every year to update your information. There's also a My Document tab here, and you can upload any documents that you feel you would want to share with researchers. So wrapping everything up, CoRDS is free of charge for all participants. Information from the CoRDS registry helps scientists to steer their research in the direction of discoveries. Patients, advocacy groups such as the PBCers and researchers are all brought to one location to combine their strengths. Again, CoRDS does not cost anything. The only thing that you would have to do is take the time to contribute your information from on the questionnaires. We also have a podcast. So if you are someone who enjoys listening to podcasts, I would encourage you to check out the CoRDS cast. You can also find this on our website. And that wraps up everything about CoRDS. As I mentioned, Polly will be there and she can answer any questions for you. She will also have a stack of questionnaires that you can take. You can either sit down with her and you can fill out those questionnaires, or you can mail them back to us. She can also help provide the link to you so you can go home and fill the questionnaire out once you get back home too. If you have any questions, you can always email me. You can always reach out to the CoRDS team. We're here to help you, and we're really excited and honored that we're able to join you today at your conference. So thank you again.